With more and more mask mandates being lifted across the country, a return to normal is actually starting to happen, which is great. But the question is, and a lot of people have been feeling this way, could this all have been avoided from the start? And there, depending on which side you are on the political spectrum, it seems to be going very much by the partisan lines here. I want to welcome physician, motivational speaker, consultant, and author of the brand new book. It's called Panic Attack, Playing Politics with Science in the Fight Against COVID-19. Dr. Nicole Saphier is on the show this morning. Good morning. Good morning. Thanks for
Good
being on the show,
morning.
by the way.
Well, thank you for having me.
First question I got to ask you, because I've always heard this. Is it true that physicians make the worst patients? Because I know you've been dealing with PT. Are you doing your PT correctly?
Well, I can tell you in my case, that is certainly the case. I'm a terrible patient. And unfortunately, so I was doing physical therapy, but
Yeah.
then I was told I needed another surgery. So I
Oh,
am
man.
only 5 weeks out after the second arm surgery, and I have yet to start PT all over again. But technically,
Well,
I should be in a sling, and I'm not.
I know, so, but
So
you have to be TV ready. You have to be TV ready. So, it's what's more important, your arm or being TV ready? And I asked that specifically because it's so funny. You have to be, I think, in today's world, you have to be brave a little bit to be able to talk about things that have any kind of political swing to them at all. And I've noticed that in my career as well. If you talk about anything that people have a problem with or disagree with, you know how it is. I mean, you really get criticized to the point where it just doesn't make sense. It's being crazy. So first of all, your book, I think, is a brave thing to do because you're going to get the Karens and the haters out there. Has that been happening to you?
well, it was happening pre-COVID-19, to be
Right.
honest.
Okay.
Just being affiliated with certain news channels people
Right.
automatically have a preconceived notion about who you
Right.
are and what you represent. But, for me, it's been like walking a tightrope throughout the course of the pandemic because
Sure.
I like to stick with the facts,
Right.
and sometimes my opinion gets inserted in there. But it was interesting what happened with COVID-19, where all of a sudden facts and actual science became partisan. And it was
Right.
like, well, wait a minute, it shouldn't be that way. If I want to cite studies, it shouldn't receive any sort of criticism that has anything political. Unfortunately, you had this knee jerk anti Trumpism, which really muddied the waters throughout the course of this pandemic. And so it was difficult to report on it, even if you were only sticking to facts,
Yeah.
because facts themselves became weaponized.
Yeah, and I've noticed that too, and we're seeing that now because if you think back, and I'm trying to think back over a year and a half now, and when you think back to when Trump was in office, the notion that this whole virus could have been released from the Wuhan lab was brought up, and it was brought up by Donald Trump, and so immediately it was conspiracy, xenophobic, all of this stuff. And now all of a sudden, Dr. Fauci, who, by the way, I'm not sure I trust him that much because he's flip-flopped so much. Why now are they starting to say, you know what, maybe there's something to this? It's all because of Trump, right?
Well, so it's interesting because my book, Panic Attack, it came out a week ago now, but there's an entire chapter in that book dedicated to exploring the viral origin theories. And one of the early criticisms of the book before it came out was that I gave too much credence to the accidental lab leak theory. And they said that I didn't say it didn't happen that way. I'm like, well, I mean, if you're actually looking at the data, and there were a lot of interesting coincidences that occurred, and I think that the lab origin theory should have been explored. But as you mentioned, President Trump mentioned it, and
Right.
immediately people were working to disprove it. And it was interesting because now we've even seen recently those emails to and from Dr. Fauci early
Right.
on. People were bringing it up to him, but they didn't want to discuss it. And I can tell you why, because at a time like that, they didn't want to politicize things. Of course, it did become political, but because they would not allow questions to be asked, now they have completely lost the trust of the public. And that's
Exactly.
wrong. Because
exactly.
just because you want to question where it came from, first of all, a lab accident, it wouldn't be the first or the last time that it caused a local outbreak, an epidemic even.
Right.
So questions should have been asked, and China shouldn't have been treated with such white gloves as they were.
Yeah, and the thing about that too, which really kind of drives me insane a little bit. I get staying on a partisan line. I totally understand that. Go team. You want to support your team, and I understand that. But in something like this, and as a physician, you wouldn't get offended if somebody said, "Look, doc, I'm not sure about your diagnosis. I'm going to get a second opinion." Yeah, that's probably, you would encourage that as a physician, right? That wasn't happening at all. It's like all of a sudden, it's like, this is what they said, this is what it is. And so you have to listen and follow the rules, follow the science, as they say. And if you don't, you're this, and this, and we're going to fight you. I've seen physical fights over masking. And it's all political, which has been percolating across the country here. Is it a fear? I mean, as a doctor, I look at all physicians kind of as scientists too, and I think you study all kinds of different facets of medicine. What's the psychology behind this? Because I know a lot of my friends that were anti-masking. It went right down to that. Well, look, we don't know who to trust. They didn't believe the elections were fair. And then all of a sudden you have the same people who were, anti-Trump and anti the elections and anti this and anti that and follow the science, this and that. And when we try to follow the science, it spins again. So I think you've got a large majority of people who just don't trust the country or the leaders of the country, and that needs to be resolved. And they're not. They're just ignoring those people.
Well, there's a reason the book's called Panic Attack.
Right.
And largely that's because the media put forth a bunch of panic inciting headlines. And what you were mentioning, when you go see a doctor, we always say get a second opinion.
Sure.
And when those two disagree, we say go get a third opinion. And
Right.
they'll probably give you another one. Because discord and disagreement is completely normal in scientific discovery, healthcare. What's not normal is the way the media treated it. Because when anyone disagreed, the media amplified that and created
Right.
the sense of chaos, which ultimately led to panic amongst the American people. But the truth is that discord's normal. It's healthy. It's how we get some of the best trial and error experimentation. And listen, the truth and best practice lies somewhere between the lock it all down and the open it all up.
Right.
The extremes of anything are probably never the right way
Sure.
to go about things. I mean,
Sure.
talking about face masks, for example. Do face masks have some benefit? Absolutely. Do the face mask mandates and wearing face masks at all times when you're outside, inside, around no one, around a bunch of people, does that make sense? Absolutely not. So they needed to be more tailored with their recommendations. And these mandates, if you really look at it, the mandates did very little. It was what the American people chose to do that was
Right.
the most beneficial.
Right. I mean, going in your grocery store and seeing arrows of which direction to go in didn't make any sense to me from a common sense standpoint. And I think that's what I was trying to relate to earlier. Is it seems like common sense has gone away.
Out the
And but like the whole thing with the grocery store, that bothered me a lot. I see these little arrows and I'm supposed to follow. So instead of getting my bread down this aisle, I'm supposed to go all the way around to the other aisle because I got to follow. Doesn't that, from a common sense standpoint, that didn't make any sense whatsoever. So I think you have all that stuff to factor into it too. Then when you look at the numbers, 600,000, close to 600,000 people dead in the U.S., unacceptable. All right, that's just, we all know that. Look at the numbers, though, and my mother's in a nursing home, so I can relate to that. And with Andrew Cuomo, it kind of fudging the numbers a little, no, a lot, and others doing that as well. When you look at it, though, it looks like it's really something that hits people over 65 for the majority of cases, right?
So
I mean,
here's the problem. Well, here's the problem. We did a terrible job. And I say we as the collective we.
Right.
Definitely. Some people have played a little bit more into those roles than others. But all you had to do was look at China and look at Italy. The people who were dying were the elderly, specifically those over the age of 75. And even the World Health Organization put out a presser very early on saying it is the elderly that are affected by this. Children and young adults are seemingly going, escaping unscathed, which was incredible. We didn't know that at the beginning, which is why kids had to be taken out of schools, because if it was like a bad flu, this could be very deadly for them. But within a couple of weeks, we had that information, which is why children should have been back at school after a couple of weeks. But the problem is, you had certain governors who were looking at their situation, seeing hospitals overflowing, and they're like, how can we open up hospital beds? I know, we're going to send people to nursing homes who are recovering from COVID-19 and still transmissible. Right. Well, nursing homes already historically are terrible for nosocomial infections or healthcare acquired infections. So the fact that we would put the most vulnerable and send them to the most vulnerable places to recover from COVID-19 was by far the most negligent and criminal act that could have been done, especially when there were ample hospital beds having been sent. You had the USS Comfort, you had the Javits Center. There were options, but now all of a sudden this partisan divide came in. Governor Cuomo did not want to take help from President Trump. And by doing that, he put a lot of people in harm's way, and a lot of people died because of it.
Does that ultimately become an ego thing? Because at some point, somebody has to be held accountable for that. I mean, like I keep talking about common sense, and the common sense is there. Somebody has to be accountable. But it goes back to, we're going to be on the winning team regardless of if we're bad players, sort of thing. When it all started, when was the first time you kind of sat there and said, something doesn't seem quite right here? What moment was that for you when you're like, wait a minute, we got to look into this sort of thing?
So it was interesting because in February, end of January and February, we had Dr. Fauci and the World Health Organization saying, this is not going to be a big deal in the United States. This is contained. There's no sustained human-to-human transmission. And to be honest, I believe them. I've always had trust in the institutions. I mean, here and there, but as a whole, I believed them. Dr. Fauci has been through many epidemics before, pandemics before even. If anyone's going to see something coming, it would be him. He dealt with the original SARS. But I had a friend of mine who is another professor, and he had a bad feeling about this, and he was sounding the alarm to me. And I'm like, I think he's being an alarmist. But then when you started hearing about the cases in the Northwest, and then there was one, and then there were three, and then all of a sudden there were cases in people with no travel history. And then we started seeing hospitalizations bump up in the Northeast. We couldn't really test for COVID yet because of a blunder by the CDC. But when I started seeing that ensue and the rise in hospitalizations, like about the first week of March, last week of February, I knew things were about to get as bad in the U.S. as it was in Italy.
Yeah, and that's when it looks like you really, because you were on as much media as you could, which was fantastic, because you have to have somebody that you can, well, like I said, a second opinion is always important. And I think having that perspective was important. And as you look at it further, the question ends up becoming, is there going to be any accountability here? What's been done is done. We all know when you look at it, and it all factors into why there's a lot of distrust in the system right now. Because when you look at somebody like Andrew Cuomo, who clearly, it's right there in black and white, he needs to be held accountable. And you still have people that are backing him with big dinners of $15,000 or $10,000 a plate. There's a bigger underlying thing here, and that's what your book gets to, doesn't it? That's part of why you wrote the book, to kind of expose some of this stuff that's going on behind the scenes.
Well, undoubtedly. And unfortunately, a lot of people need to be held accountable, not just the Chinese Communist Party. People are saying we need to investigate the lab leak theory. Yes. I think most evidence is probably lost or destroyed by now.
You think they might have had some time?
But it doesn't even matter whether it came from the wet market or the lab. We have so much ample data and evidence showing us that they covered up cases. They covered up hospitalizations. They covered up the transmission, which is why the entire world they were cut off at the knees in their global response. And then the World Health Organization echoed everything that was coming out of China. They demonstrated they were compromised. So who's going to hold the CCP accountable? Who's going to hold the World Health Organization accountable? The CDC messed up. They put out faulty tests. We could not test to save our lives in the beginning of this pandemic. That was crucial for us. And then they have continued to blunder throughout the entire course, and especially in the last few months with their updated recommendations that do nothing but to follow the science. The FDA have been dragging their feet in terms of treatments, in terms of even evaluating the vaccines. They're going slow. It's just this whole old guard bureaucracy. Everyone needs to be held accountable. And I can tell you, it depends on the administration. And right now, it doesn't seem that anyone is going to be held accountable.
How do we prevent something like this from happening again? I mean, obviously it goes right, it's all based on the administration of the time for sure, but what can we do you think, as a collective community, as an American, to be able to look back and say, look, we've got to make our own decisions here? Because part of why there's so much resistance too is I think people feel like their decisions have been taken from them, which as an American is not really what we're used to. And there is no choices given. And I think that's why Biden and the rest of the administration is going to be looking at a really tough climb, getting people on board to actually do some of the things they want to be doing. Does it all start with just new leadership?
It's going to take a lot of restructuring of many different programs. I can tell you first and foremost, and of course you'd be criticized for speaking of nationalism, but one of the things that was really difficult for us in the beginning was our dependence on a lot of other countries for our mass ventilators, testing supplies. Because the world was in chaos, all of a sudden we weren't able to import anything that we needed. And so to make sure that we have our own supply in the United States is definitely going to be crucial. We also need to make sure that a lot of those regulations remain cut back, because while we were waiting on the CDC's testing availability that completely blundered, a lot of private laboratories were trying to get forth their successful testing, but because of the red tape that we have, they weren't able to be used. And so we need to make sure that there's less regulation. There is more availability within our own country in terms of supplies. And we have to make sure that we are pushing back on all establishments. We cannot just take the World Health Organization at their word. We cannot take CCP or whichever country of origin something happens. We need to be able to do our own independent investigation. And our leaders need to be transparent, because I can tell you, when Dr. Fauci was emailing back and forth about the possibility of it being a lab origin, but then publicly he was saying, nope, this is only natural spillover. That's not truthful. Right.
And so how do you pick up and get people to trust you after that? A lot of these topics touched in your book, and we're going to put it back up on the screen here. Panic Attack, Playing Politics with Science in the Fight Against COVID-19. The title says it all, and there's a lot of great information there. Where can they get the book, Nicole? Where can they grab the book?
The book's available everywhere.
Good.
Everywhere.
Everybody should have one. And of course, your website as well.
Yeah, that's NicoleSaphierMD.com. I had to think about that for a
second. What is it called there? Thanks a lot for being on the show. Really appreciate it. I hope your second surgery goes well.
Thank you very much.
Thanks.